With us today is Tammy Smith, who's a veterinary technician specialist in dentistry, and today she's going to discuss history and oral examination on a conscious pet. So Tammy, tell us what we need to know about this as it pertains to oral health.
So anytime our patients present in our practice, typically we are obtaining a history and doing a thorough physical examination. We should always include an oral assessment as part of any physical exam. We also want to do our normal questions that pertain to the history of the patient, which include age, sex, breed, medications and supplements, what food the pet eats, whether they live inside or outside in their physical conditions, and if there have been any major behavioral changes for the pet. There are some questions that we may want to ask that would be more specific to the oral health status of the patient. Some of these questions might include if the pet has had any previous dental procedures and if we could possibly obtain records for those. Other things would be, is your pet a heavy chewer? And what does your pet chew? Does your pet have any problems eating? Do you notice any drooling from your pet? Have you noticed any problems with drinking and swallowing? Are there any changes in attitude or behavior? This would more specifically relate to favorite toys. Is your pet reluctant to play with a favorite toy or maybe a ball? Does your pet rub on the carpet or paw at their face? Is your pet dropping food? We also want to ask about tooth grinding. This is something that some people may notice, particularly with our feline patients, so it's a good question to ask, and typically people do notice when their pet has bad breath.
Obtaining a thorough history is the first step in any oral examination. Knowing what questions to ask the client can give us clues as to whether or not their pet is experiencing any kind of oral discomfort.
So Tammy, now that we've gone over the questions to ask as it pertains to oral health, what do we need to know about the oral examination?
So obviously we always want to take into consideration the temperament of our patient. Major here is going to be a great patient for us today, but some of our pets may not tolerate these types of exams, so we obviously need to protect ourselves and keep that in mind. So the first thing we want to do is look at the shape of his head and look for any obvious differences between the sides of his face, any malformations, any swellings. We can palpate here, feel for any warm spots, look for any obvious swellings. When we start to look at his actual teeth, we want to make sure that they meet in the center line and that the jaw lengths are equal so we can start to evaluate the occlusion. If the patient is cooperative, then we can lift the lip. We can start to look for things like any oral masses that we may see, fractured teeth, enamel defects, things of that nature. So we can see here that Major does have some wear on these front incisors, as well as on the backs of these canine teeth. And if we give him a minute to just relax and pant, then we can actually see a lot of his dentition without actually holding him or doing too much. He's very cooperative about that. So with his teeth, we don't see a huge amount of gingivitis or a large accumulation of tartar. He does have some wear on his teeth, which is an indication we'd really like to take some dental x-rays and assess the health of those teeth. We always want to make sure and point all these findings out to the owners when they're in the exam room with us so that they can also see what we're seeing and really understand what we're concerned about with their patient's oral health.
It's important to record the findings of your oral exam in the patient's medical record. That allows you to look back at the medical record and know your findings, and it also allows the oral healthcare team to be able to prepare for that patient's procedure.
So just to review, we want to palpate the outer surfaces of the face for heat or swelling and notice any pain that the patient exhibits while we're doing that. We want to check the lymph nodes. We want to inspect the lips internally and externally. We want to evaluate the bite and determine if there are any malocclusions present. We want to inspect all of the teeth, including the incisors, canines, premolars, and molars if we are able to. We do want to note any calculus or gingivitis, fractured teeth, missing teeth, discolored teeth. Note any retained deciduous teeth. We also want to note any oral masses, enamel abnormalities, root or furcation exposure.
Tammy, thank you for sharing this information with us today. This concludes our discussion on patient history and oral examination.